Hello, this is Mike Oliver. I'm recording a short introduction to Maria Oliver's video. My wife suffers from a rare form of thyroid disease called hypothyroidism with peripheral resistance to thyroid hormone. I need to explain a couple of things about her. My wife is extremely intelligent. This disease, one of the symptoms, not the only one, but one of them, is confusion and disorientation, which basically means it's extremely hard for her to put a train of thought together and gather her thoughts and explain them clearly. So please understand this when you're watching the video. This video is really about us trying to reach out, explain what she's going through, and asking for help. So please watch with a look of compassion, and I hope after you watch this, you'll be willing to help.
Hello, my name is Maria Oliver. I'm 35 years old. I was planning to record this video for a long time, but due to my illness, it proved to be rather difficult to keep my thoughts together and concentrate, especially that. Okay, I was born in the country of Belarus. We had a Chernobyl disaster in 1986, and it might be connected to my illness or not. Radiation can cause it too, or you can be born with it. I have a disease called peripheral resistance to thyroid hormone with hypothyroidism. I am hypothyroid, which means I don't have enough thyroid hormones in my body, and thyroid hormones are produced by thyroid gland, and they regulate metabolism and our body's energy. Everything like heart, liver, lungs, reproductive system, our brain, our hair, our skin is regulated by thyroid hormones. Without thyroid hormones, we cannot live, we will die. So the problem is that no matter what medication I take, I'm resistant to it. I'm resistant to my own thyroid hormones. It's a very rare disorder. It happens. It's some varieties of it have been researched. Unfortunately, the variety that I have had not been researched that well. I've only talked to one more patient that has very similar type of resistance to thyroid hormones. And as a result, what's happening to me, it's kind of difficult to explain and say those things, but I developed a condition called mixed edema. Mix is mucin, edema means swelling. It's a type of swelling that basically infiltrates your skin. It's like lymphatic and mucin infiltrations in your skin makes your skin grow and change shape. My lower part of my face became different, became bigger, and it's difficult to speak. My eyelids became much larger, and it's progressing all the time. My hands are swollen permanently with that type of swelling, stomach, stuff like that. It also causes very severe headaches on a regular basis because my head swells and it's extremely painful. Due to this condition, because it's not really, so far has not been treatable, even though I take thyroid medication, due to this condition, I have reproductive problems, I have gallstones, I have liver insufficiency. I can't really eat anything that has fat in any type of way. I can't really eat anything with sugar. I still do, I manage, but I get extremely sick. I have hypokalemia, and very severe hypokalemia, due to which I've had seizures and I was partially paralyzed. I black out on a regular basis after I eat anything that has any sort of carbohydrates in it, because sugar, glucose displaces potassium out of cells, and it goes low and drops, and I have severe migraines in that case and pass out sometimes. I experience difficulty breathing. It also happens very frequently, to the point when my lungs don't expand, and that's part of hypokalemic issues too. Unfortunately, me and my husband trying to control it, but no matter what we do, I still have the symptoms. Of course, I don't have seizures anymore, which is a good thing, but I barely get through the day. I have what we call potassium crashes. I have a few every day. Sometimes I'm just unable to move at all. If I sit down on the floor in a chair, I can't walk, I can't get up. I become so weak. It causes, again, difficulty breathing. It causes every day, it causes tachycardia, arrhythmia, irregular heartbeats, chest pain, stomach problems, digestive problems. I can't really eat pretty much anything. I have very severe tooth decay. In fact, in 2 weeks I'm scheduled for full replacement, full denture, upper and lower. I'm almost 35 years old, and I've been living with exposed nerves for a while. I have exposed nerves in some of my teeth, and most of them are broken. The ones in front are crowns, are fake, so they're coming off already. I mean, I've lost my teeth due to disease, and there's a lot of a whole host of other issues. I can really barely see. I see like blurry shapes. My hearing, due to swelling in the inner ear, comes and goes. Sometimes I can't hear what people are saying. I have to actually focus on their lips and read their lips. I have difficulty walking. I have disorientation spells when I don't really understand where objects are in the room and how far they're from me, and I get very disoriented. And in addition to like blurry vision, it makes it very difficult. Spatial awareness is definitely very difficult, and I can't wake up for a few hours in the morning, not because I'm lazy, but simply because my eyelids from myxedema, this type of swelling, are too heavy. And my joints are swollen after lying down, and I can't really move. Now, usually you would be used to people saying that hypothyroid patients are fat, are overweight, but it's not always the case. Some of them, especially in a situation like mine, when we can't, because of lack of thyroid hormones, we can't really absorb any nutrients and vitamins from food. Even when I take vitamins, they just go through me. I can't absorb them. Some of us actually lose weight and become anorexic or just lose weight. I mean, I like food, but I don't digest it, and I get sick when I eat, and my teeth hurt so much. And my body just doesn't retain it at all, so I don't absorb vitamins from it, and that's why I'm thin. What else? I'm cold all the time. I actually don't remember where I am if I stay in an even slightly cool climate outside for a while. I develop lethargy. Like I'm lethargic very often during the day and just can't make myself move. And in the heat, I swell severely, very seriously. First 2.5 years of disease, strangely enough, I was swollen up to 50 pounds a day. I couldn't walk. I was walking into walls, and I had to support myself. I had to go to work full time. I was pretty much just trying not to scream. I was crying all the time, being at home. Even right now, I can't really, on my own most of the day, I can't get off my knees if I sit down on the floor and, like sit down and play with the dog. I have to support myself. I often walk with a cane, especially in places where a lot of open space, like in a store or in unfamiliar place, because my balance is bad. And when I read a book, I don't remember what I read just a second ago. When I watch a movie, actually, even my favorite movies, it's so sad, but I sometimes don't remember and don't understand the succession of events. I used to be an artist and an illustrator, and my hands, when I hold them down, they swell very quickly. When I do something, especially move them and hold them down, the swelling becomes unbearable. It feels like they're going to burst, and the fingers swell really badly, joints swell right away. It's 15 minutes and I can't do anything. My hand-brain coordination is damaged, and I really can't draw a line like I'm supposed to. So I've lost my job, I've lost my home. Right now, me and my husband live at my husband's parents' house. We've been here for a year. My husband works as a cook, and no matter how hard he tries, he's got a neurological disorder, so he can't really get certain jobs, the high-paying jobs, and he would stay a cook probably forever. Unfortunately, due to his illness, he really can't do anything. He's already doing enough, and no matter how hard we try, with me being disabled, and with him, even if he works 2 shifts, he still can't. I mean, we can't survive. Going to hospital doctors, I used to live in San Francisco, and I used to go and try to convince people that, because private practitioners told me you have resistance to thyroid hormone, this is what you have. Hospital doctors, they looked at my tests, which needed a lot more in-depth research. They didn't even look at my clinical picture, the way I look, the way I feel. They didn't have time for me. Some of them called me crazy, laughed at me because my tests looked sort of normal at some point. But when you have resistance to thyroid hormone, it has nothing to do with your thyroid test. It has something to do with your thyroid receptors and with how your body processes thyroid hormone. This requires a lot of different testing, a lot of different research, and nobody had this time for me. And they laughed at me, and they called me insane. I was treated in an abusive manner by them, and unfortunately I stopped seeking help entirely, because the only time I ever got any compassion, ever got any help, is when I went and found an independent professional, independent specialist, and paid a lot of money for it, and we really can't afford it. Not for many years. So I am without medical care. If something happens, infection, tooth, nerve exposed in the tooth, I have severe fibroids, that sort of come and go and get infected, and I have infections just stemming out of nowhere because I'm ill. I have a very low immunity, and whatever happens to me, whatever complications I have, we can't go anywhere. Wherever we go, people either don't know what to do with me, or they say that I'm hyperthyroid, for example, the opposite of hypothyroidism, because they only know about heart rate symptom, that they only know one thing. It's usually each doctor knows only one thing, something very basic, and they all think that hypothyroidism is easily treated, which is not true. And in my case, I need years and years of research, and nobody really has time for me, and nobody really, actually, many times when we allowed hospital doctors to take care of me, they almost killed me. Giving me wrong medication, giving me wrong stuff, taking away my medication, putting me on a sugar drip when I had a severe potassium crash. There were so many moments when I nearly died there, and I was better off at home, that we sort of stopped going. But we can't afford a good doctor. We can't afford a good specialist who would deal with hormones, who would deal with, would know something about maybe radiation exposure, who would know something about heavy metal exposure, which I was exposed to as well when I was a teenager. And to be honest, right now, I'm just dying at home. So, I'm recording this at 2:30 a.m. at night, because I thought maybe this time I would remember what to say. Most of the time my memory doesn't even work properly. So if somebody who wants to help or has any ideas is out there, please contact us. It's been almost 7 years of very severe disease, and I pretty much lost my identity as a person. Thank you. Thank you everyone who listened.